Hi, welcome to Chapter 9. We are going to start our discussion of articulations with a mini lesson on classification. So at the very beginning of Chapter 9, there's a couple data tables or information tables that show different classifications of joints. So that's what this little mini lesson is going to be all about, is how do we classify the regions in the body where two bones meet. That's basically the definition of an articulation, or what we would call a joint. So there's three major categories of what we call functional categories. So function means what kind of movements can be done at that articulation. So we have what are called, I'm just going through the note outline. We have Synarthrotic, which means no movement, Amphiarthrotic, which means slight movement, and Diarthrotic, which means freely movable. So if we take a look at our first category, this is Synarthrotic or Synarthroses, which are articulations that have no movement. So here's a couple structural classifications. You'll notice we have a functional category, which is one of those three, Synarthrotic, Amphiarthrotic, Diarthrotic. And then within those functional categories, we are going to have structural categories, which focus on what kind of tissue is found or structures are found at that joint. So the first example of a synarthrotic is fibrous. So a fibrous synarthrotic joint, these two here, there's two examples. One is a suture. So for example, the sutures that you learned in chapter or are learning from your bone list, like your sagittal suture, your frontal suture, your squamosal suture. So those are all going to be sutures, which are fibrous in their synarthrotic category because it's just some connective tissue. Think dense, regular connective tissue. There's no cartilage, there's no other structures involved. It's just bones kind of have grown together. But then there's going to be a connective tissue in between where those bones have grown together. So this is a suture, is a type of fibrous synarthroses. The other example that they give here is with your teeth. This is a very special fibrous synarthroses called a gomphosis. So it is a connective tissue, a fibrous connective tissue between your tooth and the bone of your mandible or maxilla. It is actually called the periodontal ligament. We can kind of see that right here. That is the fibrous connective tissue that's hooking your teeth into your jaw bones. And we want these to be immovable, right? So we do not want movable teeth joints. So synarthroses, the synarthrotic articulations between your tooth and your jaw bones are called gomphoses. The next structural category of a synarthrotic joint is called a synchondrosis. So syn means no, right? So the no movement, synarthroses. And there's that prefix chondra again, right? So synchondrosis is an immovable cartilaginous, right? So here is our first structural classification under synarthroses. Here's our second classification under synarthroses. So this is cartilaginous. The example that they give here is between rib 1 and the manubrium of the sternum, synchondrosis. So you have movement between your other ribs and the rest of your sternum, but for rib 1 you don't. The last one is called a synostosis. So this is our third category under synarthrotic. So we had fibrous, cartilaginous, and bony. So bony, this is called a synostosis. So a bony fusion where you start off with two bones, they grow together and there would be an articulation, but eventually they're going to fuse. So a lot of times your synostosis is going to be where your bones are maturing from infant to childhood to adulthood. So you start off with this smaller pieces and then they grow together, and that would be your synostosis, like your oops, head's not working very well. Let's try that again. So if you remember, we had from endochondral ossification, right? So this would be our growth plate, cartilage in there. So that would be a synchondrosis. It is an immovable joint, but there's cartilage there. But if we were to show what happens when that epiphysis fuses with diaphysis, that's going to give you a synostosis, the epiphyseal line, this bony fusion. So those are some good examples of the long bones to illustrate your synchondrosis when you still have the epiphyseal plate, and the synostosis when you have the epiphyseal line. Okay, so those are the first functional categories. So synarthrosis, immovable joints. We have a couple examples of fibrous, we have a cartilaginous, and a bony fusion. The next category is our in-between. This is our amphiarthrosis. Amphi, like an amphibian, is like half land, half water. So amphiarthrosis is slight movement or a little bit of movement. So we have two structural categories here. We have the first one is a fibrous. So the example that they give here is called a syndesmosis, and it's really only found, the example that we talk about is the distal end between your tibia and fibula. So if you're working on your bone list, this is where your lateral malleolus is going to sit in the kind of pocket, if you will, on the distal end of the tibia, where on the other side of it will be your medial malleolus. So it's basically where your malleoluses are hooked together with a fibrous connective tissue. And then the other type, that's a funky too, is a cartilaginous amphiarthrosis. So the example that we have here is called a symphysis. So a symphysis is a cartilaginous amphiarthrotic joint. And we have what's pictured here is called the cubic symphysis, but we also have symphysis between your vertebrae, your vertebral disc. So we'll see that in our representative articulations. I do a mini lecture on your vertebrae, and so your vertebral discs are also an example of cartilaginous amphiarthroses joints called a symphysis. All right, and then our last functional category was our freely movable. This is our diarthroses. So diarthroses, there's only one example of diarthroses in a structural category, and this is called synovial. There's synovial are diarthrotic. Diarthrotic have synovial structure. And we're going to spend the rest of this chapter talking about synovial joints. So we're just really mentioning the synarthrotic and amphiarthrotic because you'll see these as you progress through your learning and knowledge about the skeletal system. But really our purpose for the rest of chapter 9 is going to be talking about these movable joints, the diarthrotic joints. Okay. I will mention real quick, they have the planes of movement listed here, monaxial, biaxial, and triaxial. I'm going to have a lecture, a little mini lecture on movement, different types of movement. So we'll see those words again. But basically monaxial in your anatomical position, right? You're standing with your hands to your sides. If we're talking about monaxial, the movement only is in one plane, either front and back or up and down. So for example, elbow, let's see. I can't do this very well. There we go. Elbow is monaxial. It only goes in one plane. I can't move my elbow this way. I can't move my elbow this way. It only goes in the anterior and posterior plane. And I can't rotate. I can do what's called pronation and supination, but that's at these joints here, more like your wrist, not at your elbow. Your elbow is monaxial. Biaxial would be like your fingers are really, another good monaxial that I can show better. Your finger joints, right? These guys here. They only go in this one direction. I can't rotate my finger joints and I can't make my finger bend like this way or this way. Monaxial, interphalangeal joints. But this joint here, your big joints between your finger and your hand, these are biaxial, which means they can move in two different planes. All right, so let's take a look three-dimensionally. I can have my finger go forward and back, right? So that's one plane, and then I can have it go back and forth like this. Okay, that's two planes, so that's biaxial. The third example is called triaxial, which means you should be able to move forward and back in this frontal plane and a rotational plane. So the only two places that you have triaxial joints are your shoulders, which are a ball and socket type of synovial joint, and your hips. Okay, so those are the only places you can do triaxial. All the other joints are either no axis at all because they're like synarthrosis, or monaxial, which would be like your elbow, right? One plane here. Biaxial, like your fingers, one plane here, one plane here, or like your shoulder. We can rotate we can move anterior, posterior, and we can move laterally. Okay, and there's going to be words for all of these movements. That's going to be at another video. All right, so that wraps up just this introduction of classification. So make sure you're comfortable with Synarthrotic, Amphiarthrotic, and Diarthrotic for the functional classifications, and then all these examples of structural categories like fibrous or cartilaginous or bony fusion or synovial. All right, so I'll see you next time when we just continue our journey with chapter 9. Bye.